Well, in terms of diagnosis, again, it boils down to a few factors. One, factors on the side of the patients, and factors on the side of the healthcare providers. So from the patient's perspective, it's might be simply an issue of knowledge and ignorance, and maybe our inability as as a population, as healthcare workers, and as government to give adequate information to the populace to allow them to make the necessary decisions and to allow themselves to be screened early when they recognize something to appropriately seek the right kind of care. On the side of healthcare, I think it's a resource issue. The clinics are overburdened, the hospitals are overburdened. When there is a diagnosis, there's a lag time between the primary clinic, say in a township, and when a patient is referred to a tertiary hospital where they need more complex treatment, there might be a lag time of a couple of weeks to a couple of months that may compromise the patient and lead to a patient having more advanced illness or more advanced cancer that is less manageable at the time that it is discovered. I think it's an excellent campaign, and I think it's probably overdue in terms of a focus on cancer and cancer therapy. Non-communicable diseases now worldwide, even as by the World Health Organization, have been recognized as diseases that are probably going to have the most impact in the next coming years on subsequent generations. So if you look at the Western countries now, when cancer is overtaking cardiovascular disease as the number one cause of deaths. So we're moving, and as a developing country, when we've started to control the HIV epidemic, we're going to start seeing more chronic diseases of the lifestyle, diabetes, hypertension, obesity. And amongst those, and associated with all those issues, are cancer, and they're all risk factors for cancer. And patients who live with HIV, for example, will be doing better and living longer, and they're at a higher risk of developing cancer as well, simply because of their HIV status, despite even being on treatment and having high CD4 counts or low viral loads. So this is increasingly going to be an issue, and there needs to be focus, and there needs to be a plan to combat this and deal with it. And it boils down to knowledge. Knowledge is power, screening, and ultimately the correct treatment.